Now it's time for Inspirational Women, and my guest, Dr. Noella West, an adjunct professor at both the University of Tampa and the University of South Florida. She is a national speaker and a contributing editor of The Color of Wellness, a magazine written by health professionals of color for people of color. She joins us now to provide some important insights about health issues for persons of color. Dr. Noella West, good morning. Thank you so greatly for being with us today.
Thank you. Thank you for having me.
I am very appreciative of having you join us and having a very important conversation about health, in particular, Black women and health, and the fact that there's so much disparity that occurs. And I just look at a comment that came from the National Institutes of Health that says Black women have the lowest survival rate after a breast cancer diagnosis. It boggles my mind to think that that's the case. You must have some insights as to why there would be this imbalance.
Yeah, as a African American, as a Black woman myself, the culture in the community does not always recognize that they're talking about me. Oh, I see the ribbons, I see the awareness campaigns, and they're talking, it's this sense of they're talking about other people and not me. So as a whole, the Black woman community, we need to understand that this does affect us as well. A lot of times we really don't have a good sense of taking care of ourselves. So therefore, when we finally do go to see providers or do see healthcare professionals, that sometimes it's at a point where something is already there or something that could have been detected earlier. I just think there's a lack of education and support within that community.
Well, that is so disheartening to think that this is the case. And yet, as I say that and was even thinking that, I thought, am I just being so naive that I have this attitude or this feeling? Am I being naive?
Yes, it is. It's a sense of not understanding. And I think there's a sense of lack of trust within the medical community as well. As you know, there's a lot of history behind different disease processes and different marks in history when it came to us as subject matter. Mm-hmm. So a lot of times there is a big distrust element there. And I think this is something that we really need to work on as a community.
So would that suggest then that we need more of a presence of dark skin, of Black professionals, health professionals? Well, yourself as a doctorate nurse practitioner, correct?
Yes. Yes, ma'am.
You're right there in the midst of the profession. But what are the numbers? Are they really low?
They are low. I know that they're in the process nationwide to really get a more diverse population within the medical schools, within the nursing programs, within the nurse practitioner programs. So that's something that a movement is going on. It's slowly, but they are looking at diversity. I think that's kind of our thing, quote unquote, now is healthcare diversity and disparities. But I think it's important that we need to build a culture of trust is very crucial. So the cultural competency of providers is also needed, and it's very vital for treating the Black and brown population. So someone who represents Black and brown skin can really take the time to educate on the nature of any healthcare topics, and that's really the key.
Right. But there still is going to be this time lag. It exists right now, and just the whole climate now of where education is and costs for education too, and making it affordable to invite these students to get into these professions. All of that's going to take some time. So I guess there is that building of trust with the people that do exist.
Yes, it does. It does. And I try every part, and that's not just me as a nurse practitioner, but also anyone. I know people nationwide do the teaching of, whenever having schools open for Great American Teach-In and other things and, counseling and just being in the community, in your churches, in your neighborhood. I live next to a doctor, or I live next to a nurse. It's good to kind of teach those in that community. And I'm not just saying those that live with you or in your neighborhood. But, give back. If you can talk at a school or elementary program to kind of support the healthcare industry. And I know that has come forefront since this pandemic. So it has been there. So I think we need to have that crucial conversation to kind of bring that to the forefront.
So that's one of the critical elements of what needs to go on. And then are there other ways to educate, to bring that attention? You said how, we might you might have people in the community saying, oh, yeah, that goes on, but it's not me. How do we make that more about the individual?
We really need to make sure that we're not getting immune to awareness. Education about healthcare, but especially breast cancer in the Black community, needs to be 24/7. One of those things is definitely getting the lack of services that may or may not be within the community. A lot of times there's some agencies, non-for-profit, for-profit, that do, breast cancer screenings. Are they doing it in the Black and brown communities? The church is one of those areas that is very prevalent and very strong within that Black community. Are they going to the community centers? Are they going to those areas that actually service the Black and brown community? I don't think we really are getting a key concept about where these resources are. And that's for anyone. And I think that preventative care is very important.
And it occurs to me because here in the Seattle area, greater Seattle area, we do have those vans or those big trailers that go around to do the screenings. So, and you mentioned the church. Would it be something for a church or a community center to then really be instrumental in inviting that kind of a van to the area and really support women to get the screenings in that way?
Yes, it's vital. It's very important. We need to actually go to those communities, resource those people that are in those communities, invite them to the table to have that conversation. Hey, we're going to be in this next quarter. We're going to be in these surrounding communities, these surrounding neighborhoods. Let's bring some key players in and let's talk about how we can do health fairs, how we can actually treat the public that we're serving. So that way we're making a difference in someone's life, in someone's self-care, in someone's livelihood. So I think it's very important that we bring the important people to the conversation, those stakeholders who can help pass the word, who can actually spread the word. And I think those buses and those screening tools, whether it's for colon cancer, prostate cancer, breast cancer, you would be surprised how people have a lack of medical support or lack of education about what is important in their medical health.
That sounds like really a wonderful way for communities to do something really constructive when we're kind of floundering as to what can I do to be of service or to make a difference. This sounds like one area that really has a great need, and it would be rather simple to make it happen.
Yes. I think it is. We have the resources. We have a lot of the profit and not-for-profit agencies that's out there. So we need to talk with their board. We need to advocate and really get in front of them.
Great. So hopefully we're going to reach some people who kind of have either a talent in that area or a desire to do something. And I can see that there's a way to bring these different entities together that could really make such a huge difference for in each individual's lives.
Yes.
Right?
Yeah, definitely.
So now, looking back to the healthcare professionals themselves, you yourself, do you find in your work that there are many others who look like you?
There is a small population. I would love to see more of us, not only as women, but just the African American, the Black and brown people serving in the medical health field. I think we are definitely lacking. And some of those things that can really be helpful is that when you see people like us, we need to understand that, we may be talking this medical terminology, this information that people really don't understand. So as a Black and brown person, I can always explain things. So if I'm going to be talking about, say, hyperlipidemia, does the common person know that? Does the African American person know what that means? Okay, no, maybe I'm going to do it culturally diverse and say, hey, we're going to be talking about high cholesterol, and this is what that means. This is what you need to avoid. This is what your diet. So that medical terminology and that follow-up of medications and the referrals and ordering of tests, I need to be more conscious of, all right, if I'm going to be ordering this blood pressure medication, is this something that they can afford? A lot of times, as you know, from all backgrounds, people are deciding whether they're going to be taking this medication or buying this medication versus paying their rent, paying their mortgage.
Mm-hmm.
So if I'm doing all of this education and teaching, but I'm sending them home on all of these medications or these lack of services or diagnostics, is that really going to make a difference? What am I really doing? Am I making it better or am I making it worse?
Right. And thinking in terms of how you mentioned, using the terminology, how you communicate, I think some of that could be true for any of us, that we could ask the medical professional, speak to me kind of in more English, language that I understand, not the kind of meta speak or something.
Oh, yeah, definitely. And a lot of times I find that my colleagues kind of let me have my reign. Depending on the population that we're treating, they may say, oh, well, Noella, you mind seeing this patient, or can you kind of do some education with this family and so forth? So we may have generations seeing people. So in other words, you may have a grandmother or big mama, as they call it in the Black community. You may have a daughter that's in the room. You may even have a granddaughter in the room. So if I'm going to be talking about education, like for their breast cancer or for their blood glucose / their blood sugar or their sugar water, as they may say, I may need to break things down or have a terminology that they understand because I have to treat their cultural difference. The same with the Hispanic family, the Asian family. They may have different cultures that I need to explain things that maybe the grandmother may not understand, but the other generation may say, oh, well, what about this? So you really have to cater to the individual themselves as well as who is in the room with them during that visit.
Right. And it's good that there are others in the room because there is that good connection and support of each other, I would expect.
Yes, and that gains trust immensely. They'll open up to things that, oh, well, my grandmother said that she took this, or grandmother, do you remember you said that, so it gets that comfort level down. It gives that level that trust is building. So it's very important.
And so in this time, if we don't have enough of the Black and brown professionals yet, but if we have, this other colored skin present in the room who has a heart, though, to want to communicate, to want to help in the healing process, I mean, we can bridge that kind of gap, can we not?
Oh, yes.
Yeah.
Oh, yes. We can definitely bridge that. Yes. We need to definitely understand, give the family member, give that patient time to explain themselves. Ask questions. I mean, it's like you're asking your child. Okay, they come in, they run into the house with a boo-boo on their knee. Well, tell me what happened. Well, Johnny said this. Okay, but what were you doing? You have to literally break it down to a layman terms, a third grade term, that you have to understand who you're serving, have them really feel comfortable with you, and have that comfort level that's going to be priceless.
Yes. So, yeah, and that will encourage wanting to have some regular medical visits as opposed to not being received in a way that is welcoming or engaging, right?
Right, exactly. Because you want them to be there for preventative care as well as, before something actually gets there. Because a lot of times you'd be surprised how many people aren't really doing their yearly checkups. I mean, whether it's your PCP or for women, of course, with breast cancer, OBGYN, they should be asking simple health maintenance, quote unquote, questions yearly. Have you had the flu shot? Do you have the COVID shot? Are you up to date on your tetanus shot? Do you do self-breast exams? Do you do mammograms? That needs to happen. And if your provider is not doing that, there's nothing wrong with a second opinion about any healthcare concern.
Yes, we always do say that is to get a second opinion, but I guess we need to start with the first, make sure that those
Exactly.
right, that the visits are happening to begin with, and to get into that routine. Of course, in some cases, what's going to be and has been a roadblock is having healthcare coverage. That's a big issue too, isn't it?
Yes, yes. And that's something that we definitely, there's a thin line sometimes between medical and politics. So you really need to make sure that you have your questions answered. If you're not sure, they are at any doctor's office, at any hospital, you have case managers or social workers. There are experts as far as what medical coverage that is being covered, whether it's long-term, short-term, labs, diagnostic testing, referrals. If you don't know, definitely ask your office manager, ask the nurses there at the clinic, ask your nurse that's in that hospital setting. So there's always someone that is privy to that information that can give you direction. And there's nothing wrong with asking. 9 times out of 10, they have different levels of the community that can give you referrals that are based on what that person's individual need is. So you just have to open up and say what you want. That's what we're here for.
Right. So be bold enough, really think enough of our own health and well-being to be assertive and persistent, and maybe if you don't get an answer in one place, is to get support from someone else to go in a different direction, right?
Right, exactly. And with the Color of Wellness, that is our avenue. That's one of our platforms that we do use now in the community to really get the education out there, to use diverse media, diverse voices toward health equity and wellness. So it's very important that we as a society, especially me as a African-American nurse practitioner, doctoral nurse practitioner, that we really get out there. Now, as a matter of fact, while I'm on that, I just saw literally this week, there was a recent research that said that women under the age of 40 have a higher risk now, and the rise is on for breast cancer cases for under 40, and that's because women under 40 are not usually being screened. So the ages between 25 and 39 have a higher risk now of metastatic breast cancer, which means that this spreads. It's been up like 32% since 2009. So this is something that I wanted to make sure I pointed out with your program, is that if you are having any symptoms at all, please make sure that you're an advocate and that you insist on getting screened. And most of the risk factors, the top 3 risk factors within that, if you're under 40, is if you've started your menstrual period before the age of 11, if you had your first baby after the age of 30, and or you've had any close relatives within your family who's also had breast cancer. So if you've had any of those, one of those, all of those, please make sure that you're seeking your OBGYN, your PCP, to really do some sort of screening tool, whether it's genetic testing, whether it's ultrasound, mammograms. Mammograms isn't necessarily the truth all for everyone, so that's why I wanted to make sure that I covered everything.
Right. And from a recent experience with another guest who was actually under 30 at the time, did have breast cancer, but trying to make the appointment for a mammogram screening was really, really challenging. They said, well, no, they kind of actually laughed at her. So it's so important to really believe in ourselves and advocate. Yes. You have to advocate for yourself because your health comes first. Yes. And if mammograms are very difficult, they can do other diagnostic testing. They can do genetic testing. They can do lab work. So if that ultrasound is very determined to try to get you there earlier, we can do all
other types of tests. So those are the things that we need to make sure that we're educating and let them know that this is what you need to go and ask about.
So, The Color of Wellness, this is really an important publication. It's not been around all that long, a decade maybe?
Probably about a decade, if not a little bit less. But yeah, this is something that it's from the community of Black and brown women, nurses, who, and also other healthcare advocates, whether it's mental health, whether it's self-care, whether it's nursing. This is a platform that we're using for us, by us, but also for women in general, and for the actual public. But I think we need, as voices, to kind of have our voices heard in a different platform that isn't otherwise available to us. So this is a media platform that is wonderful. It's growing by leaps and bounds, and I'm proud to be one of those executive editors toward this wonderful event.
It is wonderful. I just kind of flipped through the pages online, that is, virtually. But it is so chock full of information. And as you just mentioned, such a gamut of different health professionals that really there's something that's going to touch us at various times in our lives all of the time, I think.
Yes, definitely. From recipes to sickle cell, to breast cancer, to mental health, to anxiety, to depression, you name it, we have covered it and we will continue to cover.
And the whole issue of anxiety, mental health is certainly, since the pandemic particularly, I think we've become just so much more aware of what a huge problem exists. It existed, but it was, I think, exacerbated by the pandemic. And we need to acknowledge and be open and receptive to discussing it and receiving help.
Yes, amen. Definitely. We have to, because everyone deals with things differently. And we have to have a conscious effort that we're sensitive to that in a way that's respectful. We don't need to always, mandate and always put people on that label, but everyone has ways of dealing with things. And I think that's something that has come to the forefront to the point where everyone now is on notice, and everyone, I think, is much more sensitive to that area of mental health. We still have a long way to go, but at least we have it there now. It's something that we are having a conversation about.
Yes. And then are you in your work, either with the Color of Wellness or as a professor at your adjunct professor, both at University of Tampa and University of South Florida, is that something that comes up in the education? Does it come from the students? Any question or concerns? What is that whole atmosphere?
Well, I think this is part of my calling of giving back as well. Not only are these young nurses and nurse practitioner students going to be taking care of me when I get old, but this is something that I want to continue to create that conversation of cultural awareness. And just to understand that, why are you going to school? What is your purpose? What is your life goal at being in the healthcare industry? So I make sure that we have a conversation daily as far as, how does this apply to the patient population that you're serving? Everyone does not have the means to actually do these things. Okay, what is your alternative? Is there any holistic? Is there any things that you can do, the good old-fashioned nursing, nurse practitioner 101? And we have to make sure that we keep ethics involved, that we keep diversity involved, and that we still keep the medical profession with this supportive pathophysiology support there as well. So that's why I really love teaching as well. So I enjoy it immensely, not only the patient population, but also in the educational realm.
And that all sounds really so ideal. And I hope then it's being received in that way. Do you find that with the students, that they're excited about this, that they're ready to go out and really embrace people as humanity? Yes,
they are. They do have roadblocks at sometimes because they feel that they're trying to do the education and teaching, and some people are just kind of set in their ways, or they're kind of compliant, kind of doing what they're doing, or, so they feel a little discouraged at times, but I tell them, look, all it takes is one person to say, you know what, all right, I may not stop smoking today, but maybe I'll cut back to half a pack, but that makes a difference. What is that statistics of having lung cancer now or breast cancer? So every little bit helps, and all of these things come together to make the whole healthcare better. So I try to keep encouraging, and it is there. They are very eager.
That's exciting to know that they're eager. And the thing that I would hope might be also exciting is the fact that there's such a great need in our world right now for the healthcare professional.
Yes. And that could be anything, whether it's nurses, nurse practitioners, physical therapists, counselors, you name it, we need it. So never be discouraged if you feel like you can't handle blood. You can do something else.
Okay, I can't handle blood.
We always need someone. Yes.
Right. Well, and that's the thing. I feel there's more need for the profession, like the ones that you were mentioning. It's not that you need to be the doctor. That it's sometimes more difficult to kind of really feel in touch with the doctor. Now I know there's rigid schedules that I think having it's easier to maybe develop a relationship with the nurse practitioner, with the counselor, that kind of thing.
Yes, it is very important. The healthcare community is a whole tribe. It's not just one person. It makes the whole tribe up. So yes, definitely.
Now, so has healthcare been your life, basically your career life, your entire career?
Yeah, it has been. I actually thought about being a nurse when I was young. I was probably in my early teens, 10, 11. When I actually observed one of my grandmothers taking care of my grandfather who suffered a stroke. So I would just see the compassion. I would see her, how she would put his clothes on when half of his body was actually weak. And then I would see how she would maneuver and get him out of bed into the wheelchair, and how she prepare a meal and just take the time. And I just thought, wow, how do you learn to do that? How do you know to do that? So it's actually been my love, and I think by grace I've gotten this far, and I probably never would have thought I would have been here at this point if you asked me that back when I was young. But I think this is my calling, and I try to do as much as I can. And this opportunity, being on your wonderful show and all the positivity that you actually promote, is something that I think is going to lead me that way and continue my journey. So I really appreciate you doing what you do as well.
Well, thank you. And I love to hear these kinds of stories as well, because I think it encourages and supports others. And particularly when you said you were like 10 or 11 in that age when this came to you, I kind of think that's a significant time that we become aware of what our life's work can and will be. And so it's beautiful to hear that has been the case for you. And, here you are taking these opportunities to speak about health and wellness, but you're teaching, you have these university students, and then you have the Color of Wellness magazine. So there's just so much that you're doing, and it's all so important and wonderful.
Thank you so very much. I appreciate it. Thank you.
You're welcome. So for finding out more information, I see there's a focus on, you have a website, Instagram, Facebook, Twitter, all of that.
Yes, I am. I'm getting out into the social media platform. I love speaking about women's health. I love speaking about health in general. Definitely have a passion for neurological health with stroke and everything neuro and cardiac. I love everything health. I try to be an inspiration for everyone, especially doing self-care, because we can't take care of anyone else if we're not taking care of us. It's like the airplane, when they go over the seatbelt, they said, put the mask on first.
Yes.
Before you help your neighbor. So it's like, that kind of works. But yes, you can find me at, it's NoellaCWest.com, and that is my brand. So wherever you type that in, Google that in, I will pop up.
Well, definitely I recommend doing so because this is such important information and you are doing such great work. I'm so happy that we had this opportunity to speak. Dr. Noella West, you are truly, truly an inspiration, and this is such amazing and important work.
Thank you so much. I am honored to be here, and it was a pleasure speaking with you. Thank you so much.
You're so welcome. That brings us to the end of a very full hour of Inspirational Women with Dr. Noella West and Sunday Morning Magazine with J.O., a certified financial planner. I'm Kate Daniels, your host, and I greatly appreciate your sharing this hour with me and these special guests. For details you might have missed or information you'd like to know, please just send me an email, kated@warm1069.com, and I will get right back to you. Also, if you'd like to listen again or share these important stories with your family and friends, find the podcast on our Warm 1069 webpage. Just click on the podcast tab, then either of the show names, and then look for the guest names. I now wish you and your family a day of taking time to consider the care we need to have for good health. Have a week of the same, and then please plan to join me again next weekend for another hour of Sunday Morning Magazine and Inspirational Women on Warm 1069. Good morning.